Northern blot, southern blot, western blot, cheapest question on the planet Earth. So, northern blot is RNA, southern blot is DNA, western blot is protein. Easy to remember, but some stupid way of remembering. West is what? America, London and all. 6 feet, people will be there, highly muscular. We Indians are all brainy fellows, right? We eat very little, we work very hard, we don't get time to actually build our muscle because we build our brain. So west is protein hai, south DNA hai, north RNA hai. How will you remember south is DNA? South is Dravidian culture. Dravidians are all DNA. Obviously other is RNA. Some don't tell Dr. Murali teach like that. But this is interesting question. Which type of gel electrophoresis you use for this? Agarose gel for the southern blot, polyacrylamide gel for the western blot, formaldehyde agarose gel for the northern blot is what you have to ultimately remember. Very good. Amrit also tells west is Italy. Italy mein pizza hota, pizza mein protein hota. Huh? That is another way. Very good, very good. Amrit, yes. Dr. Soni also very good one. South mein dosha hota, north mein roti hota. So RNA is north blot and south is DNA. Beautiful. That's what. Life is all meant to be learning together. Coarse facies, protuberant abdomen, frontal head enlargement, hepatosplenomegaly, what is the diagnosis? Hurler bhi ho sakta, Hunter bhi ho sakta, iska answer. But Hurler is more common and prevalent than Hunter. What is the main difference between Hurler and Hunter? Corneal opacity is a feature of Hurler. Hunter, corneal opacity is not there. Cornea is clear. How will you remember? In order to hunt, what the men will hunt? Men will hunt for beautiful girls. इसके लिए पहला beauty को appreciate करना. Beautiness is in beholder's eye. For that, eye should be clear, cornea should be clear. So Hunter may no corneal clouding, but Hurler may you have a corneal clouding. And since Hurler cannot see well with his cornea, he will hurl. Right? Another way of remembering. So this is how coarsening of the features, facial features, is a classical thing in case of the mucopolysaccharidosis is what you need to remember. This is the corneal clouding that you can be able to see with a thickened facial features in case of the Hurler syndrome. So hepatosplenomegaly, corneal clouding, coarse facial features and a large tongue characterizes the Hurler is what I want to underscore to all of you. अभी दुनिया वालों माफ करना मैं नशे में हूं, एक नशा वाला क्वेश्चन invariably will be asked in the exam hall, right? So in India there are two things people consume even if they don't have 3 times food to eat also. One is smartphone, second is alcohol, right? So alcoholic hepatitis is day in and day out issue in the clinical practice. Gamma glutamyl transaminase is the one, typically a biomarker is what you need to remember. So you should know Child's classification of cirrhosis, where ascites, encephalopathy, albumin, bilirubin, prothrombin time are the ones which are the markers based on which the cirrhosis of the liver is being graded in Child-Pugh classification. Then MELD score, it is called the model of end-stage liver disease, takes into consideration bilirubin, creatinine and INR into consideration. Then you have some other things like Glasgow alcoholic hepatitis score also. In that age, white blood cell count, urea, prothrombin and bilirubin are taken into consideration. Remaining things you don't remember, ask your friends to remember, right? So doctor, for the alcoholic hepatitis, we use what is called as an audit score. मैं बताता हूँ what is audit score. If the audit score is more than 8, then you look for the liver function test, gamma glutamyl transaminase and SGOT. Suppose if it is being elevated, then you do an ultrasound. Suppose if there is no fibrosis or a mild fibrosis, just ask him to come for a follow-up. If there is any advanced fibrosis, consider for hepatocellular cancer screening. And suppose if the abnormal liver function tests are there and the audit score is more than 8, then you refer him to an alcohol addiction specialist who will be able to give the counseling, is what you have to basically remember. So doctor, to call and diagnose it as an alcoholic hepatitis, what are the criteria? Serum total bilirubin more than 3 milligram per deciliter. ALT, AST elevated 1.5 times the upper limit of normal, but less than 400. And AST by ALT ratio more than 1.5. And at least a heavy alcoholic use until 8 weeks prior to the onset of the clinical symptoms characterize the alcoholic hepatitis. So this is the normal liver, then steatosis develop, fatty liver. 90 to 95% of people who regularly take what is called water of life, whiskey, right? Of course, with army guys, we should not talk about, there is a lot of supply from the canteen, huh? Good. So, I think Rohit next time should get a bottle as a Guru Dakshina to me, being a Captain Rohit. Huh? I'm telling on a lighter vein, right? So, we have Captain Rohit with us today in the live class. So, steatosis, say, it will become fibrosis in about 20 to 40%. From fibrosis, it becomes cirrhosis in about 8 to 20%. From there, 3 to 10% who have cirrhosis will go into hepatocellular carcinoma, is what you have to basically remember. So what is audit? Why I am trying to emphasize so much is, what is the purpose of the previous questions? With this, what are the possible questions, new questions that can come? We should be equipped and ready when we go to the exam. Alcohol use disorder identification test is the name for the audit. So here you will ask, how often do you drink alcohol? How many units of alcohol do you drink? And how often you had 6 or more units if you are a female, or 8 or more if you are a male? You will ask, and accordingly there is a scoring table. And if this is more than 8, then that is an indication for further evaluation, is what you have to basically remember. So how is glucose transported across the intestine is a very important question. Secondary active transport. That means there is a sodium glucose symport transporter, and the sodium acts like a best man in the marriage podium to accompany the glucose while getting absorbed, is what you need to remember. That's the reason in the oral glucose, rehydration solution, we have glucose and sodium because they both are co-brothers marrying the same sister, two sisters. That's what you need to remember. What is the type of connective tissue? In the arrow which is being in this, which you are seeing. Little tough question, because histology days are like playful days. After joining anatomy first year, that is the time when histology classes we all bunk and go for making arrangements for the seniors for the college day. So histology is sacrificed for the seniors. Then osteology because all girls are English speaking, हम तो हिंदी मीडियम से आए हैं, उनको समझने के लिए for the girls you will what you call sacrifice upper limb and lower limb. Then neuroanatomy you will sacrifice because your roommate already lost the heart and he is bleeding. So like that, life in medical college is like 5 years will pass like 5 minutes, right? With good memories left. Dense, irregular type of a connective tissue. So if you look at the connective tissues, I'm sorry, this is the slide of actually loose connective tissue I took. So it can be loose, it can be dense. Only thing is you should recognize. Actually, this is loose one, right? Now, first of all, few basics on this area. Connective tissue is the typical extracellular matrix that is spread between the cells, and it has very important function. It will be forming the capsule around the organs that you see, like spleen, thyroid, etc. is formed by connective tissue. It will be supporting for the bones, it will store the fat, it will have an insulating effect, it will be transporting as blood is another connective tissue. It protects the cells as immune system is what you need to basically remember. Now, if you look at the connective tissues, they produce matrix also. Those that produce are called blasts, maintain the matrix are called sites, and breakdown is called as class is what you have to basically remember. Now, different types of connective tissues. Loose, dense, cartilage, bone, blood, they are all the examples of the various connective tissue categories. Now, what is a loose connective tissue is my question to all of you. It is also called areolar tissue, and it attaches the skin to the underlying tissues, and it contains collagen, reticular, elastic fibers is the nature of the loose connective tissue. Now, dense connective tissue, it can be dense and regular in case of tendons and ligaments. It is dense, regular, elastic in case of the vocal cords, ligaments of the vocal cords. It is dense and irregular when it is there in the scars, and it is a dense, irregular, collagenous in case of the dermis of the skin, and it can be dense, irregular and elastic in the walls of the elastic arteries. They are the various forms of the dense connective tissue. Then you have the dense, regular, collagenous connective tissue typically looks like this. Dense, irregular connective tissue, collagenous connective tissue typically looks like this. Then there are certain parts where the connective tissue has certain special properties is what you need to remember. So you have adipose tissue is an example of a connective tissue. You have yellow adipose and brown adipose. Brown is very important because of the regulation of the heat. It is thermogenic fat, and you find it in the axillae, neck and near the kidneys. Then reticular tissue is that connective tissue which forms the framework of the lymphatic tissue is what you need to ultimately remember. Now comes a very, very important questions. So Karunya Srinivasan is asking, sir, please finish JIPMA. We will do that. We will just one more session I need for finishing AIIMS November 2016 paper, because once we start a Tyagaraja Kriti, we should not stop it in the middle. We have to finish the whole Jagadananda Karaka like Tyagaraja Kriti. After that, we will start quickly JIPMA, and as many questions as possible before the JIPMA exam. Most recent JIPMA papers we will finish. That's my promise. So, what are the various lymph nodes in the neck area, and what are the various levels of the lymph nodes? अगर कभी भी ये मामले के बारे में नहीं पढ़े तो you can't answer at all. But still, these are the things where there is no guesswork. It's purely you know it, you don't know, you get out. That kind of situation. It can't be like a slight pregnancy I am carrying, you can't say. You don't have slight knowledge about it. So you have a hyoid bone, thyroid cartilage, cricothyroid membrane, sternocleidomastoid. Then here the various zones of the lymph nodes have been broken down into 6 zones in the neck is what you have to basically remember. So first is lower lip. Now what is the importance of these various 6 quadrants of the cervical lymph nodes? Because if you take the various areas of the head and neck, 1A, lower lip, mouth, anterior 1/3 of the tongue, anterior 1/3 of the mandibular alveolar ridge, they all will go to the zone 1A is what you need to remember. Similarly 1B, 2, 3, 4, etc. I am not going to read all that for you. So you should be very sure as to how these are, what is the upper and lower and lateral and medial territory of this lymph node space in the various zones. So examiner's question was on, which is a true one. The level 6 is between hyoid to level 6, yeah, is from the hyoid to the clavicle. You have the level 6 is what you, from the hyoid bone to the suprasternal area, which is above the clavicle, is the zone 6 is what you need to basically remember, level 6. Now, which part of the spinal cord will be doing the gating of the pain? It won't let the pain to go up. There is an area called the substantia gelatinosa, which will be the gating location for the pain. All pain of our body doesn't go to brain. Luckily, that is how the things are created. Otherwise, life is very painful, right? So, this area is called the substantia gelatinosa. So, you have nucleus proprius, dorsal nucleus, intermediolateral nucleus, and the Andrehorn has got the Andrehorn cells. So, in the dorsal horn, ventral horn or Andrehorn is motor, dorsal horn is all sensory. In the dorsal horn's tip, you have this substantia gelatinosa is what you have to basically remember. Actually, there is a bigger name for it. Substantia gelatinosa of Rolando is the name given for it. And why it is gelatinous? Because the number of myelinated fibers are low in density, hence gelatinous. Throughout the spinal cord, anywhere you cut it, you have on the dorsal column tip the substantia gelatinosa. So it will be there throughout the spinal cord and it will continue up in the medulla oblongata, as the spinal nucleus of the trigeminal nerve is nothing but the extension of the substantia gelatinosa at the spinal cord level is what you have to basically remember. There is also one laminar arrangement of the spinal cord. It comes under the lamina 2 is what you have to basically remember. Now, you have an arrow showing a nerve which is coming out. So, what is this nerve at the base of the skull? It is the oculomotor nerve. All of you know very well. 3rd, 4th nuclei, where are they located? Midbrain. 5, 6, 7 is in pons. 8, 9, 10, everything is in medulla. So, if you look at the brainstem is 3 levels. Midbrain, pons and medulla. So, the midbrain, say oculomotor nerve will be coming out because oculomotor nucleus is there in the midbrain. That is the place where you have the posterior communicating artery. Please give me the board. So many times we discuss this, that you have the midbrain, pons, medulla. So here you have 3rd and 4th, 5, 6, 7, 8, 9, 10, etc. Then if you take the circle of Willis, how is it located? The two vertebral arteries combine to form the basilar artery. Basilar artery will be like a stem standing behind the brainstem, and it is the one which sends the blood vessels to the brainstem. Then from this you get the posterior cerebral arteries, right? So the posterior cerebral artery and the middle cerebral artery are connected by the posterior communicating artery, and this posterior communicating artery, when the third cranial nerve comes out, it is in a close relationship with it, and it can undergo aneurysmal dilatation and compress it, and can lead to oculomotor nerve palsy, is what you have to basically remember. A very, very important relationship, right? Yeah. Marker is not, can you get one more better marker next time? Our ENT sir uses both the hands to draw the, he is called Sabyasachi, very good painter. So any number of pens are into the sky. Yeah. Very happy to see 213 online across the country. Ask your friends also to join. I am not discussing all AIIMS questions in single day because there is a little selfishness. You will tell your friends that रोज AIIMS November 2008 का कहानी चलता है, आप भी आओ free के लिए. So you can tell your classmates. That's the reason I am not discussing all questions in a single day. Yeah. Right. So this is how you have the basilar artery from which the posterior communicating artery comes out, and this is the area where even your third cranial nerve is from the midbrain. It is originating and passing to enter into the eye, and when it is passing, this posterior communicating artery originating from the posterior cerebral artery typically undergoes aneurysmal dilatation and can compress the third cranial nerve, is what you have to basically remember. So this is how the posterior communicating artery aneurysm is compressing the this is the midbrain. How will you recognize midbrain in the MRI? Midbrain looks like Mickey Mouse. Can you be able to see? It looks like a big ears Mickey Mouse, right? So this is how I used to spend a lot of time with the nurses, juniors in the duty. You teach them something, they will do all the work for you. All donkey work you need not do. Your juniors and nurses will do if you are a good preacher. So I used to say, hey sister, can you see the Mickey Mouse? Yes doctor. See, that is midbrain. Already you know that. You are as good as our neurology professor. She used to be very happy. Tell me doctor, the 3 cases I will finish. So I used to make them to do lumbar punctures, do the intubation, put central lines. So always a ward night duty should be like playful way, that you teach something to them, they also enjoy doing that, and ultimately it's a short life. When you look back, think back of your residency days, it should be the most memorable thing, right? As a consultant also, even as a consultant, you have to teach a lot of things. Even to the patients also, if there is a colostomy patient, there is a lot of education you need to do. How to live with that opening happening in his abdomen, colostomy. And patients always appreciate if you give them a hands-on training to them, right? So this is Mickey Mouse, the midbrain. And from this comes the oculomotor, compressed by the posterior communicating artery aneurysm, is what you have to basically remember.